Hi guys, welcome back. In this video we shall be talking about a very important topic, that is the hair loss and hair fall, and this video is more specific towards the males because we are going to talk about male pattern alopecia, male pattern hair loss, male pattern baldness, or androgenic alopecia. All the things are same only, okay? So why we are talking about this? Because in males we are having a hormone that is known as testosterone. This testosterone is responsible for giving you male characteristics, that is your heavy voice, more amount of muscle mass, more thicker bone density, your beard, your mustache, your axillary hair, your pubic hair, the drive to have sexual intercourse. Whenever you wake up in the morning, you're having an erected penis, that is the erection. That is all due to testosterone, okay? In short, remember, testosterone is the main male hormone, right? So whenever you're talking about this hair loss, why you will have hair loss in the first place? Because you have to remember the hair follicle which is present inside your head, okay, that is containing one enzyme, right? That enzyme is known as 5-alpha reductase. That's all you have to remember. That's an enzyme present inside your hair follicle. This is known as 5-alpha reductase. Now this enzyme is also present in other places in your body, example prostate also. So now before we start, we should understand what is male pattern hair loss, okay? What is male pattern? In male pattern hair loss, you will be having hair loss starting from this side or at this side, from the edge, and it will go and become like a semicircular. It will become a semicircular pattern, or you will have directly hair fall in the center. You will not have hair fall on this side, on this side, or directly on the back side. You will not have hair fall on the back side, okay? You'll only have hair fall in the front part, on the top part. That is the appearance of the male pattern baldness, okay? This is known as male pattern alopecia, or any androgenic alopecia, you can say. It is seen in males only. Now why it is happening? Because your testosterone is getting converted to another hormone which is the same active compound of testosterone, but it is more stronger, more potent. It is 3 times more stronger than testosterone. That is known as dihydrotestosterone. Again, this is known as dihydrotestosterone. How it is converted from testosterone to dihydrotestosterone? By the enzyme 5-alpha reductase. Where is this enzyme found? Enzyme found inside your hair follicle. This enzyme is found in your prostate, okay? So what is the function of dihydrotestosterone? Same function as of testosterone, but the function of dihydrotestosterone is not required after you reach your puberty. What is the puberty means? Once you reach your adult stage, okay? From children to adult, that age group is known as puberty. And in males, generally you're almost reaching your puberty. Your puberty is finished in around 18 to 19 years, okay? That is the reason you start to see the hair loss from that age group only. Once you reach your puberty, once your puberty is done, then the function of dihydrotestosterone, I'm not saying testosterone, dihydrotestosterone function is not required, okay? But testosterone is required till you die, okay? So that is the reason once you reach your puberty, at around 18-19 years, your puberty is done, and then you have the negative effects of dihydrotestosterone. Now what is the negative effect of dihydrotestosterone? It is going to constrict the hair follicles. Now whenever it's going to constrict the hair follicle, that means it is going to reduce the blood flow. Reduce the blood flow means less amount of nutrition. That means the hair follicle is slowly going to die, right? Along with this, now what is the treatment? Now what is the treatment that you have to do? Okay, so the treatment here is that now if I can stop this enzyme, that enzyme is converting this testosterone to dihydrotestosterone, my game is done, right? So what is the enzyme that I'm going to use? The enzyme that I'm going to use is the drug that I'm going to use is known as finasteride, okay? That medication is known as finasteride. How much you have to use? You have to use 1 milligram per day. How do you take it? You take it by orally. You have to take once a day, 1 milligram per day, okay? Do not worry, this drug is certified by the FDA. It is not going to give you any side effects, okay? Very minimal side effects. There is going to be no effect on your testosterone level, right? In 2012, in Tokyo University, a test was conducted for around 3,000 people, and they tested giving them finasteride, and very less amount of side effects was noted, okay? So, and even the FDA has given approval for using of this drug for the hair loss, okay? Along with this, you have to use another medication that is known as okay, I'll tell you what. This drug was actually used in around 1950s. Why it was used? It was used to treat high blood pressure. The name of this drug is minoxidil. Okay, minoxidil works in reducing a high blood pressure by, it is a vasodilator. That means it dilates the blood vessels. So whenever the blood vessel will dilate, obviously the blood pressure will come down to normal, it will be reduced. Okay, but it had a side effect. The side effect of minoxidil was that it causes excess hair growth. Okay, excess hair growth. You could see hair growth in your beard, mustache, in your arms, in your back, in your shoulders. So whenever they were using, in females it was a problem, in males it was not so much problem, but females it was a cosmetic problem. Then the doctors decided, why can't we use the side effect of minoxidil for the development of hair growth? Okay, from that time this minoxidil has been used for the hair loss in males. How do you take minoxidil? You take it by topical application. You use by the dropper. And what is the dose that you take? You take 5% minoxidil. 5% minoxidil 2 times a day, 12 hours apart. That is the treatment of minoxidil and finasteride. Okay, finasteride you take 1 milligram per day orally, and minoxidil, and you take minoxidil topical application 5% 2 times a day, 12 hours apart. Remember, whenever you use minoxidil, you have to use by dropper. Do not use your bare fingertips. Okay, do not use your fingertips, because this can be absorbed by your fingertips and it can have systemic side effects. Okay, so how do you use the minoxidil? Wash your hair, dry your hair, and apply on your hair. Okay, that is how you use the minoxidil. Remember, whenever you're using minoxidil, the effect of minoxidil, the beneficial effects of minoxidil will take you around 3 to 6 months. It's a very long time, 3 to 6 months. Okay, but whenever you use minoxidil, initial 1 month or around 15-20 days, you'll be seeing that you're having more amount of hair loss. Do not worry, it's a normal thing only, because whenever you're giving the hair minoxidil, it is going to dilate the hair follicle, dilate the blood vessels. So whenever it's the blood, the hair follicle has been dilated, that means the hair can easily come out. Okay, so it is the part of process. You don't have to worry. And yes, also minoxidil is also approved by the FDA. Okay, for the hair loss. So both of these drugs are safe according to the FDA, and you have to keep on continuing the treatment even if you're having hair loss by using minoxidil, which is normal. You'll be having hair loss initial few days, 10, 15, 20 days, you'll be having more hair loss, and the effect of minoxidil will take you around 3 to 6 months. Then you can see that yes, the hair follicles are growing much better. Okay, remember these drugs are going to work only if you're having hair follicles. If I apply these drugs here, I apply whatever drug I apply, if there is no hair follicle, I cannot grow hair here. So that is the reason you have to start off this treatment as soon as possible. That means whenever you see you are having hair loss, you should immediately go and meet your dermatologist, because they are the expert of hair and skin. So any issue with this, even before starting this medication, you should go and meet your dermatologist, because you can have hair loss because of other reasons as well. You can have hair loss because of your stress, some sort of thyroid disorder, some sort of medication, your anti-cancer drugs, some sort of multivitamin disorders, deficiencies, mineral deficiencies. So whenever you go to the dermatologist, they are going to take a brief history about this. They are going to do a vitamin profile test to see any kind of vitamin deficiency are there or not. If you're having some sort of vitamin deficiency, even if you're taking this medication, it's not going to work. A, B, C, D, E, K, all these vitamins, if you're having some deficiency, it's not going to work. Along with it, if you're having some mineral deficiency, zinc, selenium, manganese, all these micronutrients are deficiency are there, that can be found out by the blood report. You have to correct it. Along with this, if you're having folic acid deficiency, again you can have hair loss. Along with this, if you're having iron deficiency, yes, hair loss can be there. Along with this, if you're having thyroid disorders, you can have hair loss. So all these things have to be checked first, then you have to start off this medications, right? And also you can have hair loss even if you're taking a lot amount of stress. Now yes, how can you differentiate the hair loss is due to stress or due to testosterone? Remember, whenever you're having male pattern hair loss, the hair will start from the edge and this part will be only coincised. Okay, the top part, this top part will be the having hair loss. There will be no hair loss on the sides. Okay, but in stress induced hair loss, their hair fall will be entire head. It won't be focused on this side, this entire head. You will be having hair fall. That how you can differentiate due to stress or due to testosterone, right? So that was about a video about hair fall, and please talk to your dermatologist. They can explain you much better, and it is always advised and told, and a disclaimer is given that whenever you take any sort of medication, any sort of medical help, or any sort of medical treatment plan, you have to meet your doctor first, and then you have to discuss, and then you have to take the action. Okay, along with this, please try to have less amount, try to manage your stress. Even with stress you can have hair loss. Along with this, do not have direct exposure to the sunlight. If you're taking smoking or alcohol, cut it down. It will help you to conserve your hair. Okay, and remember, whenever you start the treatment, as fast as you start the treatment, it is much better, more beneficial. Along with this, you have some another treatment, that is you have a hair transplant. Okay, what they do is that generally if I'm having hair loss here, they'll take the hair from this part and then directly place it here. Why this hair, you don't see hair follicle hair loss in the back part? Because these are very resistant to this enzyme 5-alpha reductase. They're resistant to this they are resistant to this 5-alpha reductase enzymes is less here, one thing. Along with this, they will be having dihydrotestosterone. They're resistant to this. That's why you will not see hair loss in the back part. Okay, that is the reason they'll place it from back to the front part. Along with this, you can sometimes use a wick if you want, or sometimes they can also give you a treatment of PRP, platelet rich plasma. That is, they're going to take out your blood, they're going to centrifuge it, that is concentrated with a lot amount of nutrition, and they're going to inject onto your scalp. Remember, PRP treatment is temporary. Once you stop the treatment, it will again you'll have hair fall. Okay, this treatment, once you do the treatment, it will work for you around few months, around 6 months, and then again you have to repeat the treatment. Okay, that was about the hair fall. I'll just quickly summarize. It is seen in males, that is known as male pattern hair loss. It will start from the side, will become like a circular, like arc-like pattern, will not be on the side, will not be on the back, or it will be just on the front part. Okay, and it will be seen at the age of, it will start from around age of 18-19 years, and this time till about 25 years, this age will be more susceptible for developing male pattern hair loss. Why? Due to the overactivity of dihydrotestosterone, because after puberty you do not need the functioning of dihydrotestosterone, so it is doing an ill effect to your hair. Okay, along with this, remember, if you are having prostate cancer, as I told you, in prostate also you are having 5-alpha reductase, so this dihydrotestosterone can work in the prostate and cause you prostate cancer. So in prostate cancer, the same drug has been given, finasteride, but in this time the dose is 5 mg. But in hair loss, we are giving you 1 mg per day, once a day, orally. Okay, so the medication that you can use is finasteride along with minoxidal. Please do not apply with directly your hand. Use the dropper, wash your hair, dry your hair, apply minoxidal 12 hours apart, 5% topical solution of minoxidal. Along with this finasteride, 1 mg per day, orally, just once a day. Okay, these are the two drugs. Along with this, you should always go and meet your dermatologist to have the expert consultation and expert opinion. Along with this, you need to see that you're having good amount of balanced diet. You have to manage your stress. Along with this, avoid direct sunlight exposure onto your hair. Along with this, do not apply very harsh kind of chemicals to your hair, that is your wax or hairspray. Please do not apply it. Along with this, try to manage your stress. And whenever you apply this minoxidil, it will take you around 3 to 6 months. Initially, it will cause you more hair fall. You have to continue the treatment. Do not worry about this. Along with this, finasteride and minoxidil are approved by the FDA. So these are the safe drugs that you can take for this. Along with this, you have platelet rich plasma therapy. Along with this, you have your hair transplant. Along with this, you have your wick that you can wear the artificial hair. So these are the basically main treatment plan algorithm that you can do out for your hair loss. So that's all for now. I hope you find it some helpful, and I'll see you in the next video. Thank you.